Hello, my name is Jerry Baldwin, and today I will be talking to you about the drug Lyrica. Recently, I had a patient who presented to my office requesting to take this drug. She stated she saw this drug on a commercial and she really think it would help relieve her fibromyalgia pain. As a result, I located this commercial and I watched it. On the commercial, it depicted a middle aged female who stated she has been suffering from excruciating pain, and due to this pain, she's unable to perform her activities of daily living. She then started taking the drug Lyrica and had relief of her pain. And now she's able to perform all the activities that she was unable to do before. I then also located the PI insert for this drug. I just wanted to see how accurate the commercial described the drug Lyrica. And I was very pleased to say that in the commercial it did present accurate information on the drug, such as um, side effects, adverse effects, and usage of the drug. I then approached the patient and we sat down and I actively listened to her and her concerns and we talked more about the drug Lyrica. I explained to her that right now scientists aren't exactly sure how Lyrica improves fibromyalgia symptoms, but research suggests Lyrica helps decrease the number of nerve signals and as a result, this calms down oversensitive nerve cells. And this appears to alleviate pain in patients with fibromyalgia. I then also taught more to her about exactly what is fibromyalgia. I explained to her that fibromyalgia pain is believed to be brought on by nerve related changes, which cause nerve cells to fire off too many signals. This can cause a person to be overly sensitive to stimuli that are normally not painful. We then also just started back talking more about the drug Lyrica. I explained to her that I would like to take a look at all the medication she's on because there are certain drugs that interact with Lyrica. One of the drugs we reviewed and make sure that she wasn't taking was ACE inhibitors, which is used to treat high blood pressure. If ACE inhibitors are taken along with Lyrica, it would increase the chances of swelling and hives. The next medication I wanted to make sure she wasn't on is medicines that is used to treat diabetes, such as metformin, Actose, and Avandia. If these drugs are taken with Lyrica, it would increase the chance of weight gain and also swelling of your hands and feet. I then also looked to see whether or not she was on any type of narcotic pain medicine and also any type of anxiety medicine. Because if she takes this medicine along with Lyrica, this would increase her chance of dizziness, sleepiness, and possibly oversedation. And we don't want that to happen. Also, I talked with her about whether or not she has been experiencing any depression because patients with fibromyalgia normally, have depression. She stated that she was not, and I just wanted to let her know that taking the drug Lyrica can increase her chances of depression and also suicidal thoughts. And if she ever experienced that or is experiencing that at this time, we would not want her to be on that drug. Also, we talked about other uses for the drug Lyrica. The drug Lyrica can also be used for pain that can be caused by shingles, Also, pain from diabetic neuropathy. This drug also has been used as an adjunctive therapy for seizures. And also, this drug has been used for pain with people with spinal cord injuries. And I just wanted to just talk to you now about my thoughts as far as pharmaceutical advertisements. I think at times they can be misleading because many people will watch an advertisement on television and believe that the drug will cure them of their ailment. And at times, they will be reluctant to listen to the advice of a professional. Some ads also will exaggerate more on the effectiveness of the drug and understate descriptions of side effects. And just for example, in the commercial that I watched about Lyrica, it stated that you should talk to your healthcare provider because this drug will work to relieve your pain. Well, the problem that I have with that statement is that when a patient hear this, they will automatically think that this drug will relieve their pain and they will approach their healthcare provider for this drug and they will just think that they should be prescribed this drug. And some patients can get upset if you go into explaining more things and if the drug comes out to be not a drug of choice for them, they would just automatically think, well, I saw this on the television and I really think that it will work and they said it would work and I just want to try it. So that can be an issue. But one of the good things that I do like about pharmaceutical advertisements is that by advertising drugs on television, that is a way that you can get that drug out to the public. Um, the public will be introduced to many new drugs and they will have the knowledge of those drugs and they will also be able to research information. And when they do talk to the healthcare provider, they can talk more to detail about that drug and see whether or not that drug will be right for them. Thank you.